All right. Well, hello, everyone. And I am Alex. I'm the founder and CEO of Lena Health. And we have created an AI care coordinator. But the journey really started with me at the Texas Medical Center, where I worked in the largest medical center in the world, 60-member institutions. Among of those that you see there are ones that I worked with directly. And I was a strategist and then eventually fellow. And what I saw was that there are just not enough care coordinators, not enough nurses out there. And there are many, many patients, the majority of patients that are high need patients that no one ever gets to support, to provide care coordination, care management. And what I did is I worked with that population myself. I navigated them for years because I was curious about why can't we scale care coordination to this population. And so you see the gentleman there, his name is Joseph. I supported him, and essentially I spent all of my time helping him with non-medical needs, helping him find a specialist, a dentist, and fix his wheelchair, and coordinate with insurance to be able to pay for it. And it turns out that 94% of all of their needs are navigating non-medical needs, navigating our complicated healthcare system. And so if you look at a rare disease, sickle cell disease, these are some of the crazy stats that they have to really navigate. Multiple doctor's appointments every year, therapies, many doctors, multiple screenings, medications that they have to refill and coordinate. How they're going to pay for that. And so it's really mind-blowing for someone like me, which I am tech able. I can't imagine for a family or an individual that's going through these conditions. And so why can't we scale care coordination? Well, it turns out that most of the time is spent by a care coordinator calling a insurance or a clinic and being on hold. And so what we did is we built Lena to be able to handle those calls. Lena is a telephonic AI that can call insurance, call clinics, call the patient, and handle those care coordination tasks that are needed to coordinate care and make life easier and simpler for patients. The way that we built it is we took humans and did the care coordination over 2 million data from the Texas Medical Center, and we created this AI model that allows us to handle these tasks. And what we were able to do, because we coordinated across all types of populations, build libraries of care journeys that the AI can handle multi-step tasks for patients. And so our human in the loop model, we've deployed it across multiple different populations, and we found that we can reduce costs to care coordination by 12x compared to a nurse. And a study by one of our customers, Houston Methodist, resulted in reductions in ED visits, hospitalizations, and readmissions. And this is our really incredible team of people that have done this before. And I'll just mention that we were funded by the Texas Medical Center, Freighter, one of our customers, and others. And we're lucky to be well funded today. So I'll go ahead and stop there. Any questions? Thank you.
Thanks so much. Are there disease areas in particular that you're focusing on and just for your launch and initial test here?
Yeah, so we started with a type of population called the rising risk population. So it turns out that every health system, every insurance plan out there is identifying this rising risk population. Usually they are the ones that have 2 or more chronic diseases, and they're predicted to be high utilizers, so high cost patients. But there's just so many of them that they can't ever get to them. So we started with the elderly. A rising risk population. Why? Well, because they're not using the patient portal. Many of them have landlines, and so telephonic care coordination is one of the main ways to get to them. But we are now coordinating with caregivers for kids, caregivers for elderly with dementia, and so there's so many applications across populations for this. Thank you.